Welcome, everyone. Thank you for joining us today for the Global Rural Nursing Exchange Network's webinar series, Subjects That Matter Most. Today, we are very excited to hear from our storytellers. I'm just going to go over a few things real quick, just for some, in order to reduce some unwanted noise, if you could be muted just for the time being. But if you have any questions, please feel free to type in the question box. Once it comes to question time, you can unmute yourself. But yeah, if you have any questions, we will be answering those. All right, so today, the presentation will be facilitated by Kathy and Jerry. Kathy and Jerry are the co-founders of Worldview Intelligence and co-authors of Building Trust and Relationship at the Speed of Change. Worldview Intelligence provides a great framework for engaging conversation, solving issues collaboratively, and storytelling. The work they help create, they create connections, bridge differences, and inspire hope for the future. Kathy lives in Nova Scotia on Canada's East Coast, and Jerry lives in Minnesota in the US. All right, so without further ado, I will hand it over to them.
Great, thank you, Chrissy. Welcome to each of you, and a big welcome to our storytellers today. This is our second session today, and this morning went really well. So I'm super excited to hear people's stories and then to hear questions that you all might have as you listen to the stories. I'm just going to talk a little bit about the flow of our call today, and then Jerry's going to talk more specifically about the storytelling process, and then we're going to invite the storytellers in. So that actually is the first part of the call. And each storyteller will have about 7 minutes to tell their story. The invitation to you as a story listener is to listen with intention and to notice as you listen to people's stories, sort of what inspires you or what touches you. Because after all three storytellers have told their story, you're going to be invited into small group conversations to share what's coming up for you. And the storytellers will be in their own small group to talk about what their experience was like sharing stories here in this online session. And once the small groups are finished, we're going to come back. We're going to hear a little bit of what happened in your small group conversations, and we'll hear from the storytellers. And then Chrissy's going to share with us the platform and other places that you could be sharing stories, because one of our hopes is that the storytelling just begins here. It doesn't stop here, but that people find other ways to share your stories, because the shortest distance between two people is a story. And in this day and age, the more we can be connecting around the things that inspire us and the things that work, the better off we all are. Jerry.
Thanks, Kathy and Chrissy, and welcome everyone to our little, I'm going to say afternoon session, but some of you might be morning in another part of the world, and delighted to see you all here. We had a wonderful time this morning. The stories that we heard were just a delight and impactful, and so we're excited to hear the stories again this afternoon. Just a few weeks ago, Chrissy and Corey, who couldn't join us, so most of you know, and Kathy and I met with the storytellers, and we talked just a little bit about structure. Stories have a beginning and a middle and an end. And so we wanted to invite the storytellers to kind of work with that structure, and all of them have. And so the beginning that the storytellers are working with is to describe a challenge that they have faced or are currently facing in their work. So sort of inviting us into the story by describing what it's going to be about. And then the middle of the story is, what are they doing to meet this challenge, or what did they do to meet the challenge? And that's sort of the larger body of the story itself. And then the end is, what did they learn, either from the work that they did do, or what are they learning now in the work that they're in? So this beginning, middle, and end of a story, all six storytellers, the three this afternoon and the three this morning have used this structure. And it's the structure that if you decide to share in the future one of your stories into the network, we might invite you to use also similarly, this beginning, middle, and end. And so I think Carl is going to be our first storyteller this afternoon, and look forward to hearing from you, Carl. And thank you, everyone.
Good deal. Thank you very much. And it is such a pleasure to be here today. Thank you all for the invite. I hope that my story will reflect more on how my health system helped me get where I am, as opposed to the actual personal story that you're going to hear from me. I have been a nurse for 35 years. Most of that time had been as a flight nurse. I flew on a helicopter as a flight nurse for about 20 years. I'm currently a vice president and administrator of a small 25-bed hospital. We are a part of a larger health system that is headquartered in Roanoke, Virginia, and that health system is Carilion Clinic. It is about 25 miles north of the hospital that I am located at. As a health system, we have about 13,000 employees, 7 hospitals, and we have a level 1 trauma center with a level 3 NICU, and we use 3 helicopters to support our system. Our hospital, our system, and most of our hospitals are based just below the beautiful Blue Ridge Mountains in Virginia, and we have a lot of farmland, which is why most of us consider our hospitals and our place of work as a rural setting or rural hospitals. The administrator before me actually called our hospital a suburban hospital, meaning both rural and suburban, but he always said that we just forgot to tell the cows. So that's how we kind of view ourselves in a rural setting. My hospital is not necessarily technically a rural hospital because we don't meet all of the necessary criteria. But if you look around, the rural name constantly comes up. I'm hearing impaired, and that is part of the story that I hope to be able to share today. I also wish to share how my health system has helped me grow in my nursing career. And I hope that I can demonstrate how our health system has grown with the diversity and inclusion program, more specifically in the handicapped world. So I was born deaf. I currently wear 2 hearing aids, and I depend heavily on lip reading. And you can only imagine how the last 2 years have been affected by my communication style. I wanted to go into the military, but at the time I knew that I could not pass the physical for any military involvement. However, I set my sights on the next best thing, and for me, that was nursing and helicopters. And so I joined a EMS crew, took my EMT course, signed up for nursing school, graduated from a small college, an associate degree program at a community college, and became employed in a level 1 trauma center at Roanoke Memorial. And what's really interesting about that is my first day on the job, everybody followed me around so that I could see their face. And it was really an important step for me because that told me that they were very interested in making sure that I survived and became a nurse in their hospital. They were very willing to help me out that way. The story that I like to tell a lot, though, is when I applied to be a flight nurse, there was a lot of concern about me being a flight nurse and wearing hearing aids. And so I was able to convince the flight crew leadership to take me up on a flight and ask me questions. And they could wear their headsets and their helmets, and I wouldn't wear any. So I did not wear a headset. I did not wear a helmet. I did the entire hour-long interview in the helicopter on a flight simply by lip reading. And that was enough to convince them to allow me to interview in an 8-hour interview process for the job. And I got the job. And so that was the highlight of my career, if you will. In 2000, I became the clinical team leader of the flight crew and continued flying. And I think it's really important to just simply understand that with a rural setting and the caring people in those settings is what really has helped me advance my career. We have a great diversity and inclusion program here at Carilion Clinic. There's a lot of emphasis on resource groups that we call BRGs. And we have a veteran BRG, a disability BRG, we have a women professional BRG, a multicultural BRG, and an LGBTQ BRG. And so I think that it says a lot for our system and the setting that we live and work in, that people are so willing to help each other out and make sure that we advance as far as we want to go. COVID has certainly been a challenge for me. And as you can imagine, we're wearing a mask, wearing a goggles, we are wearing a shields. And the lip reading part has been quite a challenge. People in my system know me. They're well aware of my needs. And I had people coming out of the woodwork to make sure that I could get a mask with a clear shield so that I could hand those out at every meeting that we were going to, and I could continue to read their lips, even though they had a mask on. I had people calling me all the time, looking for ways to help me. And I'm not sure that I could have received that kind of help in a non-rural environment. So I'm blessed and I'm very appreciative of the work that I do and the place that I work at. And the rural environment has certainly helped me with my nursing career.
That is, that's so encouraging to hear, Carl, that you were given the support that you needed to be able to excel in your career. And even when the circumstances got more challenging with COVID, and who would have thought that things would get more challenging in nursing than they already were. So that's a thank you for sharing that story.
Yeah, and thank goodness for virtual, and we can do a meeting virtually. I can see everyone's face, and I only hope and pray that when we are doing a virtual meeting that we practice proper virtual etiquette.
Excellent. Chrissy, did you want to introduce the next speaker?
I would love to. And Carl, thank you. What a wonderful story. So next up, we have Nicole from the United States, and her story she'll be sharing is named Birth Name.
Thank you. It's a delight to be here, and I'm really happy to be able to share this story. I believe that there are no coincidences in life, and many of the things that we encounter or experience are things that were meant to be there for us. They're not just haphazard events. My name is Nicole Ruhana. I'm a nurse midwife and a nurse practitioner. I currently serve as an assistant professor in a public university and I supervise graduate nursing students. I live in rural central New York, so I'm nowhere near New York City, but we are up in the rural part of the state. And I have learned over the last 40 years of my practice that I've always somehow ended up in rural. And it was not ever planned that way. It was just a series of events that kept leading me to one rural place after another. When I was very young, probably at the age of 25, I worked for 2 years in a hospital in Saudi Arabia. And this was in the northern part of Saudi Arabia, about 80 miles south of the Israeli border. So it did not have all the money and the glitz and the glamour that you would normally think about in Saudi Arabia. I worked for the Ministry of Aviation and Defense, really in the middle of the desert. And for those of you that are nurses, you know that sometimes you get pulled away to another department to work for a shift. So I was working on a pediatric contagious disease ward, and one night had to go to the labor and delivery unit. And for those of you know, labor and delivery is either feast or famine. There's either lots of pregnant women and there's nothing. So I was there on a very busy night. It was not my area of expertise, but I was assigned one labor patient who was a young woman that was part of a nomadic tribe that was traveling through northern Saudi Arabia with her family and her tribe. And she was in active labor for her first baby, and the labor had stalled out. So they stopped at this small rural hospital for care. When I went in the room, I was surprised to see that there was no IV, there was no fetal monitor, there was not any of the normal things that we would see here in the United States for birth. And for me, that was a pinnacle night because I was able to experience normal, unmedicated physiological birth that I would never have the experience to have here in the United States. The patient was cared for by a nurse midwife from England, and that again was eye-opening because it was a totally different model of care than I was used to. The midwife would come in every 15 minutes or so, listen to the baby's heartbeat with a Doppler. She did not have an IV, the patient did not have an IV. She was able to eat and drink, and she was able to ambulate during her labor. She was supported by 3 other wives in her family that were considered matriarchs, and they would support her from behind when she was contracting. So it was not only a different specialization for me, but it was a whole different culture and how this family experienced birth and brought a new human into their circle. It was a night shift, and I just remember getting lost in the time. Time was just warped, and I remember that when I was providing care to this laboring woman, I felt like I had come home, and I immediately knew this is what I had to do. There was no other opportunity. There was no other choice. I had to become a nurse midwife. When it was time for the lady to deliver, she delivered in a squatting position, and the midwife had pillows between her legs, lowered the baby onto the pillows, and immediately put the baby to the breast. The mom started breastfeeding again with help from the other older wives in the family. And I stepped back that night to see this breastfeeding mother being supported by other wives, which was very foreign to me, but I felt like I had just helped create a masterpiece of a painting. I stayed with them for a while. The patient went home after 8 hours for early discharge, and the baby was declared normal and healthy. And they left, and they had an early discharge, and they went on their way. But it was a profound experience for me to experience a different model of care by a midwife, and in a different culture, and with a whole different expectation of what normal family life is or was in that situation. I finished my contract there and immediately came home and did 2 years of labor and delivery nursing, and then I went to nurse midwifery school. I practiced for 20 years in rural Pennsylvania, and many of my patients were farming women that would come in from the farm and then come into our hospital and deliver their babies. So for me, that was a pinnacle moment. It was life-changing for me. It was career-changing. And I just feel I hope other young nurses have the opportunity to experience something like that, that really makes them feel like they've come home professionally and can get passionate about their career. Thank you.
Oh, again, what a great story. I love how your story is both about your personal journey, but it also brings together what Jerry and I would talk about as these worldview experiences. And it is often through experience, different cultures like you described, you know, not only were you an American in Saudi Arabia, but you had a nurse from England. And so you have this juncture of all of these different worldviews that informed that experience and just fueled your own journey. So that's a great story. Thank you so much for sharing. Great.
Wonderful story. All right. So next up, we have Kate Stark from New Zealand, and she will be sharing her story behind the scenes. Kate, I think you are muted.
Sorry, there we go. Thank you for the opportunity to tell my story today. We've just heard two beautiful stories of nursing, both with a rural flavour. So I'd love to be able to tell you that I'm talking about something completely different, but I'm not. My journey really is what I want to talk about today. I'm a nurse practitioner and I work in a rural general practice or primary healthcare clinic in central Otago, which is in the middle of the South Island of New Zealand. I haven't always lived rurally. I grew up in Dunedin, which was an urban centre, and did my nursing training in Dunedin and spent 3 years overseas as well, travelling and nursing. And when I came back to New Zealand, getting married was never really on the cards. It was never an option for me at that stage. However, I met a farmer and then my life completely changed. So I found myself living on a farm, down the bottom of the South Island of New Zealand. And really, at this stage, I had been working in neonatal intensive care. So you don't find a lot of neonatal intensive care units in the small district where I live. So I had to really rethink about what I was going to do for my career, wanting to carry on with my nursing despite also having 2 small children early in our marriage. So I just wanted to talk a little bit today about the multiple challenges that I've had, personal and professional really, around becoming a nurse practitioner in a rural setting, which was not really where my roots were. And also a little bit about how it's affected me personally and changed my practice over the years. I never set out to be a nurse practitioner. When I started working rurally, I joined a practice where we had, there were 2 other nurses who were on the training program to be nurse practitioner. And I thought in the first instance, it would be a good idea for me to sharpen up my assessment skills. So off I went to uni and did a paper. And then before I knew it, I had a diploma, a postgraduate diploma of clinical nursing, and then thought to myself, oh, well, I may as well carry on and do my master's because I'm halfway there. So I decided to carry on, and then suddenly I had a master's of nursing and had watched 2 other nurses in my practice become nurse practitioners and kind of thought, oh, now that could be quite cool. So off I went and finished my journey on the nurse practitioner program. Found myself working in a rural clinic, although I quite liked what Carl said about the Rururban, because the clinic that I was working in was in a hospital that had an X-ray department. It had a blood taking lab, it had physiotherapy, it had the occupational therapist, it had a ward, it had maternity. So it wasn't really the rural that I was used to working at. So I carried on finishing my training there and did my first 3 years as a nurse practitioner. During that time, I really found it difficult getting to grips with the expectation from myself around what being a nurse practitioner meant, and also the people around me, because suddenly I'd been in the same job working as a rural nurse specialist and then become a nurse practitioner, and the nurses I worked with struggled with the concept of nurse practitioner because it was very new. So I spent 3 years in that job with the intention really of trying to consolidate my 6 years of study and the increased knowledge that I had around conditions that I was now expected to manage because I had the words nurse practitioner after my name. So I guess I felt a lot of things at that time. I felt a lot of imposter getting into my head. I felt, difficulty with acceptance from other staff, both medical and nursing, actually, because there was a lot of misunderstanding about the role and how it would fit into the current model that was already present. So what I tried to do to get through these challenges was to be really patient with myself. I really needed to think about, some of the things I'd learned over my course were some 6 or 7 years old, and suddenly I had to try and pull everything back into the care that I delivered to patients along the way. So I was really patient with myself, and I also had to educate others about what my role involved, what it is and what it isn't, just so that people really had an understanding. I offloaded a whole lot of other commitments that I had that were cluttering my head, because I felt that I needed to focus solely on consolidating what I was doing as a rural nurse practitioner. And also I wanted to gain some more understanding about what it was inside my head that was saying to me, you should know that, why don't you know that? You don't need to go and look it up because you should know it. And then I noticed that the doctors around me were also looking things up, and I started to realize that I actually had imposter syndrome. And so I needed to think about how I was going to manage that. So that was where in my career I started to have professional supervision for the first time. And it was really quite powerful. And we worked through the process of what I'd experienced leading up until that point and what I wanted for the future. So I gained a bit more understanding about that, and I started to trust myself a little bit more in what I was doing in my day-to-day practice, and started to feel a bit more confident about where I was going. So it changed what I did in my practice. I no longer wrote a novel in my notes. I no longer wrote really defensively about, what I had to write everything down, because as nurses, we're trained, if you haven't written it down, you haven't done it. So I had to become really savvy, because we only had 15-minute appointments, and there was no way that I could do that lovely assessment and document the head to toe assessment like we were taught in our training. So I really had to change what I was doing. Professional supervision really assisted me in this, and it helped me change my attitude and my practice. So after 3 years, I left this job, and I went back to my rural roots, and I found myself a job in a very small practice that was very rural, where I am now, where the staff had a great understanding of what a nurse practitioner did. The trust that owned the practice were very supportive and saw having me as a bonus, because it had really struggled to find a general practitioner and to stay in that area and work. So suddenly I found myself as a gap filler for a GP, and the patients were starting to call me Dr. Kate. So again, I had to revisit this whole imposter syndrome again, and really reground myself into what it was I was able to offer, what I was able to achieve in my day, and building those relationships with my patients around my role as a nurse practitioner and not a GP. So that was also quite challenging. So along all of this, probably what I've really learned is, be yourself and be true to yourself. Really get a feel for where you are at personally and professionally. And it's important to integrate the two, because, you spend maybe 10 hours at work a day, but you also need to go home and fit into where your family sits as well. And so I found that initially challenging, because the role I'm doing now is not in the town where I work. I drive an hour on a Sunday night to a place in central Otago, which is rural, and I stay there 3 nights a week, and I work my 3 days, and then I go home to the farm. So that for me, again, has been another challenge in trying to disconnect myself from my work brain and reconnecting myself at home. So the balance of personal and professional life I've really had to work hard at that, to make sure that I can sustain my role. I've learned resilience skills, and probably I don't personalize comments from people as much as I used to around nurse practitioners, because I feel more comfortable and more confident in my role now that I'm 5.5 years down the track. I've got a much better understanding of myself, and I believe that my performance at work has improved as well. I think I feel really comfortable about the fact that, I don't know everything, and I don't need to know everything. I need to know where to find things, and that's enough. The staff around me are fantastic, and probably I don't have as much fear as I used to have of needing to perform. I try my best and I do the best job that I can, but I also care about what's happening around me.
That is great, Kate. I think you hit on something that every single person in this call and most all of us could identify with, which is this notion of self-doubt and imposter and how we find our way through our own personal growth to get to the place that you're describing for yourself right now. It's quite wonderful. Great. Wow, this time went fast already. Like now we're at the point of the breakout sessions. And so we're going to invite you into small group conversations. And the invitation is to just chat with each other about what you heard, about what inspired you. Yeah, I got my cat sitting on my notes again. You know, anything that you may have learned that you're going to take away for your own learning. So anything you learned, what inspired you, what touched you from the stories that you told, from our storytellers who told such deeply personal stories. And Chrissy's going to send you off and the storytellers are going to go into their small groups and you're going to have about 20 minutes for your conversation.
And the storytellers, when you're in your group, one of the reasons we're creating the group of you is because we want to learn from your experience. So share with each other your experience about a storyteller. What was that like? What did you learn? Because that information we'll use to inform future events like this, or things that can be really helpful for your colleagues as they tell their stories in the future.
Wonderful. All right, I will open up the rooms.
Thanks, Chrissy. And I put the questions in the chat box.
Welcome back, everyone. I hope you had some good stories to share. So if one of you would like to start, if you are the chosen one to share what you all heard from each other.
And we'd like to invite everybody to put your cameras on. We think we're okay bandwidth wide. So in this large group, we can see everybody. So that would be just great. And then as Chrissy invited, if one spokesperson from one of the small groups would like to share out some reflections from your conversation, that would be terrific.
I'm Lori Joel, and our group of three, we talked about the nurse generalist role that came out that we heard about, that we're all very proud of, and how that ties in with your practice as a rural nurse. And we also talked about empowering nurses and how to address the challenges. And so the one thing that I brought forward that they wanted me to talk about was, I just feel like nurses need to get to the table and be leaders within healthcare organizations. An example of being on a hospital board. The hospital board doesn't have a nurse on that board who is speaking for the care of those people. And so we need nursing to get in leadership roles and have that voice.
Great, terrific. Thanks, Lori. We're going to ask our storytellers to go last and talk about their experience. So someone else from one of the other groups that might like to share some reflections out.
I'll talk. So my name's Cynthia. I'm from Melbourne, Australia, but I'm stranded in New Zealand at the moment in lockdown. I can't get back to Australia. So there were 4 people in our group, and from Norway. One was myself around the other side of the world and in another hemisphere, and then there was Greta from Norway, and there was Audrey from America, and also I just can't remember the last lady's name, but it's from North Carolina. So we had a really nice sort of mixture, and 3 of us were actually in education. And we were talking, 2 in tertiary sector, 1 in the private sector. And so we were talking about the need for what kind of education may be needed going forward, bearing in mind that the COVID had really changed or really had an impact on the whole way that we were thinking about healthcare. And we spoke about how telehealth was really very important. But then it had even extended itself into intensive care in remote areas and communicating back to the mothership via an iPad, and the challenges that this raises. And we just touched a tiny bit on the concept of moral distress, but also we touched on the issue that education might need to broaden to look at things like cybersecurity in this sort of world that's changing as it is. And then finally, we looked at the idea that the profile of nurses over the last year or so has actually shifted them quite a lot, particularly in some countries where they don't have much image, much visibility, into a more visible role, and that this had actually been very important. So there were sort of more general topics, but they intersect quite a lot.
Fantastic. Thanks, Cynthia. And I hope you do be able to get home at some point.
I'm hoping on Sunday. I've had my flight cancelled 3 times.
Oh my goodness. Oh, well, that's the world
Mad
of
world at the
travel.
moment, isn't it? It's a mad world.
It is. It is great. Well, we know I have one other small group, and we'd love to hear from that group before we hear from our storytellers. So who would like to go? I think we have one other small group. So
We should have one more. But if not, we can always go ahead with the storytellers.
let's hear from our storytellers. And maybe we'd like to hear from Kate and Nicole and Carl each. So maybe Kate, I see your microphone is off. Maybe you'd like to share a little bit about your experience.
Yeah, so we talked about, in our group, we talked about the impacts of working rurally, the challenges of working alone, and really a bit about nurse practitioners and their roles in different places and how they're accepted in different places, how they're utilised in different places. And we also talked a little bit about some of the challenges that we have working rurally that kind of carried on from each of our storytelling. So yeah, no, it was great because obviously the rural flavour was very, very strong, and also the working independently was very strong. And the discussion we had around COVID-19 and the challenges that it's created for each and every one of us. And the thing that struck me too was that, you know, I'm in New Zealand, a little country on the other side of the world, and yet there's challenges that are happening in the US, you know, very similar kind of challenges around mandates for vaccines, mask wearing, all that kind of stuff. And, you know, the fact that there are some staff leaving because they don't want to be vaccinated, which is very sad on one hand, but, you know, if you are a believer in vaccination, you know, it's hard to understand why they would do that. So yeah, really interesting conversation around COVID, and also just, you know, challenges for rural nurses working in isolation.
And Kate, and for all three of you, as you worked on creating your story and thinking about the story you wanted to tell and planning it out, you know, were there any insights you gained just about the story itself or your experiences in the circumstance? How did this offer any kind of new insights for you?
Carl, do you want to answer that question?
Yeah.
All right, great.
I can jump in.
Sorry to dump you in it.
Yeah, I can actually jump in on that. So the insight for me is, as a administrator of our hospital, I encourage every one of my staff members, my leaders, to be kind. And in being kind, they need to give everyone a chance. And so I was given a chance, you know, by talking the flight crew leadership into giving me a pre-interview before the actual interview. And I think that it is well worth our time as leaders, especially as nurse leaders, to really look into every single person that is interested in working in your hospital or your clinic or wherever you may be. Everybody deserves a chance. And there's always a way to help those people who need a little extra with their role.
Great. Thanks, Carl. Appreciate it. And Nicole?
As storytellers, I felt an element of camaraderie and validation with my new storyteller colleagues. So we only met each other once before when we were approached to tell our story. And even though we're from very different geographical regions, we're dealing with very similar challenges, not only within our medical system, but also emotionally and psychologically. You know, we talked about how students and patients and some of our professional colleagues really just don't have the emotional reserve because they're dealing with the remnants of you know, the pandemic. And it was just very validating that we could connect so quickly and share so many different themes on very similar levels.
Great, thanks, Nicole. As Kathy said earlier, you know, like I said, the shortest distance between two people is a story. And in fact, our brains think in terms of stories. They don't think in terms of bullet point PowerPoint presentations. And so through story, we can make some wonderful connections. And I think that's some of the powerful work that the network is trying to do, is build those global relationships through the stories we can share with each other. So thank you all, the three storytellers. And I'm going to hand this over to Kathy.
I'm just noticing that there's a few more comments in the chat box for anyone that wants to really take a look there. Thanks to Audrey and John, I think for the most part, for making the comments over there, but just things like inspired by Kate's statement, I don't need to know everything, but know where to find the answers, which I think is true for most of us, no matter what we're doing. And good to remember. And the notion that Carl was able to find support in his health system, and yet the midwife nurse had so much more challenges in trying to find that support. And I just, my personal note is I was also struck, Carl, by your needing to convince people that you could even have an interview, but your own capacity to be able to advocate for yourself in that way was quite something. And then Cynthia says the emotional side of nursing is becoming a ticking time bomb. And I have to say, I do some work in healthcare here in Nova Scotia, and that the health and well-being of our people who work in healthcare is one of my biggest worries and concerns for my clients, because I don't know, this strain was already great before COVID, and it's that much greater now. And even if you're not in healthcare, we're COVID weary as nations around the world. And that just adds a strain to everything as well. So I just, for myself, I have the deepest amount of admiration for the work that you do. I'm glad you do what you do. And I've been very inspired by the stories and the questions and the reflections that have been shared both tonight and earlier today. So I thank you for that.
Thanks.
Chrissy, over to you.
Wonderful. Well, thank you all so much. I would just like to invite all of you to participate on our networking tool that GRNEN has launched. We are hoping to get you all engaged and share your stories on there so that the rest of the rural nurses on the platform can hear and share and converse with all of you. So it's a very easy process. I'll put the join link in the chat box, and I'll also add that in the follow-up email as well. And this is a complimentary registration. There's no fee for this. So we really encourage you to take advantage of that. And if any of you are interested in scheduling a quick Zoom recording session with me to share your story through video, I would love to do that with you. I'll put the info in the follow-up email. But on the networking tool, we'd love for you to share your story in any way that you would like, whether that's written, audio, video, any artwork that you have that you just want to share that you think represents your story. We'd love to see that. So I'm just going to share my screen really quick and just kind of show you what the networking tool looks like so you can get a little feel for it. And so when you come to it, you will have to register first. It's just, it's very simple, first name, last name, email. But you will go to the communities tab up on the top. And we'd love for you to share in the open forum so that everyone can see your story. And as you can see, it's super simple. You just add your discussion post, and even if you don't have a story to share, we'd love for you to share anything else that you would like. But we are hoping to see you on there and to share with everyone. So that's it for me. And I want to thank all of you for joining us and sharing your story. It was so wonderful to hear from everyone. If you have any questions, please follow up with an email. And I look forward to hearing from all of you.